We are recording.
All right, great. So, all right, let me just see here. Hopefully, does not record my screen, right? It's just the video, hopefully, because I'll have all kinds of text messages.
No, it's just the video screen.
Okay. All right. I'm Dr. David Danish with Philadelphia Integrative Psychiatry, and I'm here with one of my colleagues, Chris Smith, today, our head of autism programming. I'm a child, adolescent, and adult psychiatrist outside of Philadelphia, and one of our specialties is working with kids and adults who are on the spectrum, and there are many comorbidities. I come at it from a psychiatric point of view, while Chris Smith, who I'll introduce now, comes at it from the therapy and behavioral side of things.
Absolutely. Yes, as Dr. Danish said, my name is Chris Smith, and I am a board-certified behavior analyst and licensed behavior specialist and therapist and director here at the practice, and I do oversee our autism and behavioral health programming.
Yeah, and Chris and I have known each other for many years. I was very excited to learn that he was finishing his master's and has extensive work and experience with all ages of kids and young adults on the spectrum, and with all levels of intellectual abilities as well. So we've worked well together for many years, and Chris has worked really hard at expanding the program and now has a fully comprehensive ADOS screening program, as well as a treatment program, which includes many behavioral analysts that work below him as well. And one of the things we're really excited about that we're going to expand into pretty soon is actually providing some group work for parents of kids and young adults on the spectrum. So, Chris,
absolutely. And, we have definitely interest in creating some openings for the parent group in particular that will be virtual in nature and, kind of open, open feedback around the concepts of, parenting children with neurodiversity, whatever that means, not just exclusive to autism or ADHD. So I wanted to address the question that came in from Erica at Confident Parenting. The question was how to find a good neurodivergent friendly psychiatrist, as well as options for some parent groups for kids struggling with neurodiversity. So one of the things that I was that kind of came to mind for me when thinking about this question was researching the providers. The great thing about modern technologies, most agencies now have websites with provider bios. I know at our Philly Integrative website, you can really dig deep into the provider bios for our prescribers, our therapists, and you really want to get a sense of, does this provider have any history working with children that are similar in diagnosis to my child? For instance, if you look at the provider bio, does it talk about working with children with a history of depression? Does it talk about working with a child who has autism or intellectual disabilities or ADHD? What is that provider's specialty? That's a really important feature of modern websites and when you're researching providers.
Yeah, no, 100%. And we've been very, very careful to put all of our relevant experience there for each of our profiles. But that's also why I was so excited to work with you, because that's one of your main specialties. It's not something you do as a side project. It's really what you're focusing on from a therapeutic perspective, which is essential. It's your bread and butter, if you will. I will say, as a psychiatrist, because of the fact that I'm child adolescent board certified as well as adult board certified, that gave me a lot more experience diagnosing and working with autism in younger ages, and then working with it throughout the lifespan, which is going to be very different than someone who's just a psychiatrist that's used to working with adults. They're not going to really have that same experience. Part of the training that I go through is working with behavioral pediatrics at Children's Hospital Philadelphia and going through their ADOS and their testing for autism as well. So we were able to get that experience, but then all of the experience I had after training was over, working inpatient, I was often working with kids on the spectrum. I would say close to 25% of the patients that I work with are on the spectrum. I'm often working with comorbidities that they're dealing with, but close to 1 in 4 of my patients are on the spectrum. And a lot of my patients who are not on the spectrum may have relatives who are on the spectrum as well. So dealing with it from a family or sibling perspective too. So good. No, I wanted to make that introduction of Chris and myself. And if you guys have any questions, you can also text us. You can email us. We'll provide our contact details. We also are really good at finding the right resources, even if it is not our team that provides that service.
Absolutely. And the second part of the question did again focus on the interest in finding parent support groups, and I just wanted to say that we are very excited to be launching something like that in the very near future. So please stay tuned to our website and social media, as we really do hope to provide a place where parents can engage and have some support in a virtual setting. That is facilitated with someone with lots of experience in children with neurodiversity.
Nice. All right, awesome. Thanks, Chris. Good to talk to you.
Absolutely. You too.
All right, thanks. Bye-bye.